The trauma bay doors blew open at 11:47 on a Tuesday morning, and nobody was ready for what walked through them. 3 Black Hawks. Military markings. No warning. Armed soldiers flooded the emergency room of Cascade Ridge Medical Center in the middle of a routine shift, pushing past confused nurses and startled orderlies, moving with the kind of controlled urgency that made everyone in their path press flat against the walls. The man on the stretcher was bleeding from 4 separate wounds. His blood pressure was in freefall. His oxygen saturation was dropping by the second. The team leader grabbed the nearest doctor by the collar. "We need Viper. Where is she? Supply wing. Where's the supply wing?" Nobody understood the question, but one woman in a faded blue scrub top, standing at the end of the corridor with a clipboard and a case of IV saline, went completely still. She had hoped she would never hear that word again. Before we go any further, if you're new here, hit that subscribe button right now, because stories like this one are exactly what this channel is built for. Real tension, real characters, real reversals. Drop a like if you're already hooked, and tell me in the comments what city and country you're watching from. I read every single one, and I genuinely want to know how far this story has traveled. Now stay with me, because what happens next is the part nobody sees coming. Her name was Nora Vasquez, and the thing most people at Cascade Ridge Medical Center knew about her was that she kept the supply room organized better than anyone had in years. That was it. That was the full extent of what they knew. She was 34 years old, medium height, with dark hair she wore pulled back so tight it looked like it was part of her uniform. She didn't wear jewelry to work. She didn't keep photos at her station. She had been employed at Cascade Ridge for 7 months, transferred in from a staffing agency with a work history that had a 3-year gap right in the middle that nobody in HR had bothered to ask about. The hospital was located in Dunmore, a mid-sized city in the eastern part of Wyoming, the kind of place where the winter came early and stayed long, and the regional trauma center served everyone within a 140-mile radius who couldn't afford the drive to a major city. It was a busy hospital by rural standards, perpetually understaffed, and the people who ran it had the particular brand of exhausted arrogance that came from doing difficult work without enough resources and deciding that entitled them to treat anyone below them on the org chart like furniture. Nora had understood all of this within her first 2 weeks. She had chosen it deliberately, quiet, small, under the radar. A place where nobody would look too closely at a supply nurse who was good at her job and kept to herself. The ER supervisor at Cascade Ridge was a woman named Darlene Marsh. Late 40s, short, with the posture of someone who had been compensating for insecurity with institutional authority for so long that the two had fused into one unpleasant personality. Darlene had placed Nora on supply rotation from day one and made it abundantly clear that was where she intended to keep her. "You've got the organizational skills for it," Darlene had said on Nora's first morning, in a tone that made it sound like a compliment but felt like a door closing. Nora had said thank you. She had unboxed bandages and cataloged medication orders and learned the names of the people who actually mattered in the building. Not the administrators, but the orderlies, the ward clerks, the night shift nurses, who kept the whole operation from collapsing while the people with important titles went home to sleep. She had learned which doctors were careful and which ones were reckless. She had learned that Dr. Preston Hale, the senior trauma attending, had a habit of skipping pre-procedure checks when he was running behind, and that he kept a coffee thermos at his station that always smelled like something other than coffee. She had learned that Darlene protected Preston because Preston's father had been on the hospital board for 20 years, and because Preston generated enough billing revenue that the administration was willing to ignore the occasional complaint filed by nurses who had watched him make calls they disagreed with. Nora had filed none of those complaints herself. She stocked the trauma bays, she inventoried the crash carts. She made sure the things that needed to be where they were supposed to be were, in fact, where they were supposed to be. And she waited for the kind of quiet life she had told herself she deserved. It didn't fully arrive. The problem with having the training she had was that the knowledge didn't stay dormant just because she wanted it to. She would be walking past a trauma bay and catch, without meaning to, the way a nurse was positioning a patient's airway and know, with the certainty of muscle memory, that it was wrong. She would be restocking the medication cart and notice that the epinephrine dosages had been logged incorrectly, a discrepancy small enough to overlook and significant enough to kill someone during a code. The first time she flagged it, she brought the discrepancy to the charge nurse with what she thought was appropriate tone. Calm, factual, not accusatory. The charge nurse, a man named Darren, who had been at Cascade Ridge for 11 years and had the self-confidence of someone who had never once been seriously wrong about anything, stared at her for a moment before saying, "Are you a pharmacist?" "No," Nora said. "Are you a doctor?" "No." "Then let me handle the medication logs and you handle the IV bags. That's how this works." Nora said nothing else. She went back to the supply room and updated the error in the system herself, quietly, through a secondary reporting pathway she had located in the hospital's intake documentation. The discrepancy was corrected the following morning. Nobody acknowledged it. Nobody knew it had been her. She told herself that was fine. The second time, it wasn't something she could route through a back channel. She was delivering supplies to Trauma Bay 3 when a patient came in. Male, late 50s, chest pain, diaphoretic, the whole picture. Preston Hale was the attending. He was already 40 minutes into a shift that had started badly, and his assessment of the patient was moving too fast, skipping the kind of deliberate examination that the patient's presentation warranted. Nora stood at the edge of the room with a case of IV tubing and watched Preston order a protocol that didn't match what she was seeing. The patient's neck veins were distended. His trachea had a subtle deviation that Preston hadn't checked for. Nora set the IV tubing down on the nearest counter. "Dr. Hale." Preston looked over his shoulder with the expression of a man who had not asked to be interrupted. "What?" "His trachea. Have you checked tracheal position?" The room went quiet in the specific way rooms went quiet when a person who was not supposed to have opinions had one anyway. Preston's jaw tightened. "I'm in the middle of a workup." "I see that. I'm asking if you've checked tracheal deviation, because his JVD presentation is—" "Thank you," Preston said, and the words were a dismissal, not a response. He turned back to the patient. Nora stood there for exactly 2 seconds. Then she picked up the IV tubing and walked out because there was nothing else she could do, and she had promised herself she was not going to be the person she used to be. She was 3 steps down the corridor when she heard the monitor alarm. She stopped, turned, walked back to the doorway of Trauma Bay 3. Preston was now moving fast, too fast, scrambling, because the patient had just decompensated in exactly the way she had seen coming. It took them another 4 minutes to stabilize him. 4 minutes that would have been 30 seconds if anyone had checked the trachea. Preston did not look at her when it was over. He wrote his notes and moved to the next patient, and later that afternoon Darlene Marsh appeared at the supply room door with her arms crossed. "I heard you interrupted Dr. Hale's assessment this morning." I asked a clinical question. "You restocked the trauma bay. That's your role. Dr. Hale's assessments are not your concern." "The patient is fine," Darlene said. "And I want to be very clear with you, Nora. You're here on a temp to permanent contract. That contract can be revoked. If I hear that you've been inserting yourself into clinical decisions again, I will make sure this conversation goes into your file. Do you understand?" Nora looked at her. Darlene had the kind of eyes that needed compliance like other people needed oxygen. Not because she cared about the outcome, but because disagreement was a form of disrespect she had long ago decided she would not tolerate. "I understand," Nora said. And she did. She understood it completely. She went back to counting bandages and marking expiration dates and moving through the building like a shadow. And she tried very hard not to look at the patients she passed in the way she had been trained to look at them. It worked, more or less, for the next 3 weeks. Then Marcus Webb was transferred in. He came by ambulance from a highway accident 40 miles outside Dunmore. Motorcycle versus guardrail, the guardrail winning decisively. He was 26 years old, conscious and combative, with road rash across half his body and a left leg that had been stabilized in the field, but not well. He had a tattoo on the inside of his right wrist. Small, deliberate, a unit designation. Nora saw it when she was delivering supplies to his bay. She stopped moving. The tattoo was from a particular special operations group. She knew the design because she had seen it on the wrists of men she had worked alongside, in places where stopping wasn't an option, and the only tools you had were the ones you'd brought with you. She finished her delivery. She went back to the supply room. She sat down in the small chair behind the door that she used on breaks, and she did not move for 4 minutes. Then she got up and went back to work. Marcus Webb was not her patient. Marcus Webb was 26 years old and alive and in a hospital with people trained to take care of him, and her job was to make sure those people had what they needed to do it. That was the boundary. She held it. I was in this trauma ward for 3 days, recovering from surgery on the leg, and Nora stayed entirely out of his care pathway. She saw him in passing twice, once when she was delivering to the adjacent bay, and once in the corridor. And the second time, he looked at her with the particular focused attention of someone who had been trained to assess everyone they encountered, and something shifted in his expression. She kept walking. On the 4th day, he was discharged. Nora exhaled. The boundary had held. She was restocking the 3rd-floor medication room 6 days later when Darlene appeared behind her. "We need to talk about your contract." Nora put down the medication package she was holding. She turned. Darlene had Preston Hale with her, which was unusual, and a man Nora didn't recognize. Middle-aged, administrative lanyard, the expression of someone delivering something pre-decided. "Your temp to permanent conversion has been reviewed," the administrative man said. "Given the incidents in the last month, the interruption during Dr. Hale's trauma assessment, the unauthorized access to the medication reporting system, we've decided not to proceed with the permanent offer." Nora was quiet. "You're not being terminated," Darlene added, with the precision of someone who had consulted HR before this meeting. "Your temp contract will simply conclude at the end of the current cycle, 30 days from today." Preston said nothing. He stood slightly behind Darlene with his arms crossed, and he didn't quite look at her, and that, Nora thought, told her everything she needed to know about how much of this had been his idea. "I want the incident reports," Nora said. "Pardon?" "The incident reports, the ones that were filed to justify this decision. I'd like to see them." The administrative man hesitated. "Those are internal documents that I have a right to review under the terms of my employment contract. I'll come to HR this afternoon." She looked at Darlene. "Is there anything else?" Darlene's jaw was tight. "No." "Then I'll finish the medication restock." She turned back to the shelf. Nobody moved for a moment. Then they left. Nora kept stacking medications with her back to the empty doorway. And she breathed slowly, and she thought about the 3-year gap in her employment record, and the heavily redacted file in the HR system, and the fact that nobody had looked closely enough at either of those things to understand why a supply nurse had known to check tracheal deviation before a senior trauma attending. She thought about a village in a valley she was not allowed to name, in a country she was not allowed to describe, where she had worked for 19 hours straight on casualties that would have overwhelmed most surgical teams, with field supplies and improvised tools and the particular cold clarity that came from having no other option. She thought about the name they had used for her then, Viper. Not because she was dangerous, because she was fast and precise, and she struck exactly once. She thought about why she had stopped. She thought about this promise she had made to herself on the transport flight home, that she was going to build a life that didn't require her to be that person, that she was going to find a version of nursing that was small and manageable and didn't cost what the other version had cost. She finished the restock. She clocked out at the end of her shift and drove to her apartment and made dinner and didn't think about any of it. 30 days, she told herself. 30 days, and then she would find another hospital, another supply rotation, another quiet corner of a system that needed someone to count things carefully. That was the plan. The plan lasted 11 days. On the 12th, she woke up at 5:40 in the morning to the sound of her personal cell phone. Not her work phone, her personal phone, the number she had given to fewer than a dozen people in the world, ringing with a caller ID she had not seen in almost 2 years. She stared at it for a long moment. She answered. "Vasquez." The voice was familiar, worn, carrying something heavy. "We have a situation. We need Viper." Her hand was very still on the phone. "You have the wrong number," she said. "Nora." A pause. "Sergeant First Class Damon Reyes is on life support at your hospital right now. He came in 40 minutes ago. They don't know what they're looking at, but you will." She sat up. "What do you mean he's at my—" "Cascade Ridge, Dunmore. We know you're there." Another pause. "We need you in that building." She was already standing. She was already reaching for her shoes. "I'm not Viper anymore," she said. "Tell that to Reyes," the voice said. "He's got about 40 minutes. The call ended. Nora Vasquez stood in the middle of her apartment at 5:42 in the morning, and she made a decision she had been trying very hard to not make for 7 months. She grabbed her badge and her keys. She drove to the hospital. When she came through the ambulance bay doors at 5:58 a.m., The ER was already in motion. Not the controlled motion of a team managing a situation, but the faster, messier motion of people who were working hard without having the right picture of what they were working on. She found him in Trauma Bay 2. The man on the gurney was 38 years old, built like someone who had spent his entire adult life in physical readiness, and he looked wrong in the particular way that Nora recognized from fields and forward operating bases. Not the wrong of someone who was simply hurt, but the wrong of someone whose body was running out of the mechanisms it used to compensate for being hurt. She read his chart from the doorway. The ER resident had him on a sepsis protocol. That was not what this was. She walked to the gurney. The resident, young, early 30s, visibly stressed, looked up. "You can't be in here, this is—" "What's his core temp?" Nora said. "Core temperature. Right now." The resident glanced at the monitor. 35.1. "And his MAP?" 62, but we have him on—" "Stop the fluids." Nora's voice was flat and certain. "He's not septic. This is traumatic capillary leak. You keep pushing fluids, you're going to drown him." She looked at his abdomen. "Has anyone imaged the abdomen?" "We have a chest x-ray." "That's not what I asked." The resident straightened. "I'm going to need you to tell me who you are before I make any changes to—" The ambulance bay doors opened. 4 soldiers walked in. They were in full kit. Not the loose civilian dress of people transporting a patient, but the operational gear of people who had come from somewhere fast and hadn't had time to change. The one in front was a woman, early 40s, command-bearing, the kind of stillness that came from being the most capable person in every room she walked into and knowing it. She scanned the trauma bay and found Nora in approximately 1 second. Captain Vasquez. Nora had not been called that in 2 years. The resident's head turned. The room went quiet. The soldier crossed the bay in 6 steps and stopped in front of Nora, and there was something in her eyes that wasn't quite relief but was adjacent to it. The specific look of someone who had located the one resource that could change the outcome. "He's deteriorating faster than the timeline we were given," the soldier said. "What do you need?" Nora looked at the man on his gurney. Damon Reyes, Sergeant First Class. A man she had served alongside for 8 months in conditions she was legally prohibited from discussing in any civilian setting. A man who had held a tourniquet in place for 45 minutes on his own arm while she worked on the man next to him and had not made a sound. She had 11 days left on her contract at this hospital. She had 37 years left of knowing how to do this. She turned to the resident. "Get me a fast ultrasound and a cut-down tray," she said. "Right now, and get Dr. Hale on the phone. I'm going to need a surgeon, and I'm going to need him awake and ready in 4 minutes." The resident didn't move. She said, "Get the tray." The soldier's voice was not loud, but it was the kind of voice that did not require volume. "Now." And something in the room shifted. Not dramatically, not with any announcement, just the quiet, decisive tilt of a situation that had found the person it had been waiting for. Nora Vasquez pulled on a pair of gloves. She did not think about the 30 days. She did not think about the meeting in the medication room, or the lanyard, or Darlene Marsh. She looked at Damon Reyes, who was running out of time on a gurney in a hospital that hadn't known what it had standing in its supply room. And she got to work. The fast ultrasound probe was cold in her hand and the gel went on wrong. Too much, smeared sideways. Because the cart had been positioned for a right-handed operator and Nora worked left-dominant in field conditions. An adaptation from a deployment where her right hand had been braced against a wall for 40 minutes while she used her left for everything that mattered. She corrected without thinking about it. The image came up on the monitor and she saw exactly what she had expected to see, which did not make it better. Free fluid in Morrison's pouch. A significant collection pooling in the hepatorenal space with the particular density pattern of blood that had been accumulating for longer than anyone in this building had realized. The abdomen was compromised. Whatever had happened to Damon Reyes before the soldiers brought him through those doors, and she didn't have that information yet, not the full version, had included a trauma to the right upper quadrant that the intake team had missed entirely because they had been focused on his fever and his pressure and had built a clinical picture around the wrong framework from the first minute. "Internal hemorrhage," she said, "right upper quadrant. This is not a sepsis presentation." The resident, his name tag said Ortega, had the particular look of someone recalculating everything he had done in the last 40 minutes. His temp, hypothermia secondary to blood loss. His body is redirecting resources. The fever reading was from the field. Whatever he had going on before they brought him in, the temperature drop is happening now. She didn't look away from the monitor. How long since his last pressure check? 6 minutes. Check it again. Ortega reached for the cuff. The soldier, Major, Nora had clocked the rank on her collar without intending to. Her brain had never stopped doing that even after she'd stopped wanting it to. Was standing at the bay entrance. Not pacing, not talking, just present in the particular way that senior operators were present in uncertain situations, which was to say, completely still and completely ready. Her name was Valdez. Nora had worked with her twice, years ago, in circumstances that were not relevant to discuss here. Maps dropped to 58, Ortega said. Get the OR on the phone. Tell them we have an abdominal hemorrhage coming up, probable hepatic laceration, we need a team ready and… She did the math in her head. 8 minutes. Can you get me 8 minutes? This last part was directed at Ortega, who looked like he was doing his own recalculating, and she needed him functional right now, not spiraling. I can try to get Dr. Hale. I don't need Hale yet, I need the OR. Can you make that call? He straightened slightly. Yeah. Then make it. He moved. Nora turned back to Reyes and put her hand on his wrist. Not to check the pulse, the monitor was doing that, but because she remembered from the 8 months they had worked alongside each other that Damon Reyes responded to physical contact in crisis situations in a way that a lot of operators didn't. Some people went inward when they were hurt. He went outward. He needed something to push against. She pressed 2 fingers against the inside of his wrist. His eyes opened, not fully. Halfway, with the unfocused effort of someone fighting through a significant pain response and blood pressure that was no longer adequately perfusing his brain. Reyes. His eyes moved toward her voice. It's Vasquez. You're at a hospital. I need you to stay with me for about 9 more minutes, and then you're going to be in a surgical suite, and this part will be over. Can you do 9 minutes? His lips moved. She leaned in. Didn't know you were… The words were fragmented, air and effort with very little behind them. Didn't know you were here. Nobody did, she said. That was the point. Something crossed his face that might have been almost a smile, under different circumstances. 9 minutes, she said again. Count them. She straightened and looked at Valdez. What happened to him? Valdez moved 2 steps closer and lowered her voice. Not information I can give you in an open bay. I'm not asking for classified operational details. I'm asking what physical trauma he sustained before he arrived here because whatever it was happened at least 4 hours ago and the field assessment missed the abdominal component, and I need to know if there's anything else I should be looking for. Valdez held her gaze for a moment. Then, vehicle rollover, high speed. I was ambulatory at the scene, showed no abdominal symptoms for the first 2 hours. Delayed presentation. That tracked with what she was seeing. The internal bleeding had been slow initially, masked by the adrenaline and the body's own compensation mechanisms, and then it had crossed a threshold and started dropping him fast. The fever reading from the field had been a red herring. By the time the ER team had him, they were chasing the wrong problem. Anyone else? Nora said. One other. He's stable. Already in surgery at a different facility. Okay. She looked at the monitor. Okay. Ortega reappeared at the bay entrance. OR team is being assembled. Dr. Hale is… He paused. Dr. Hale is asking who authorized the surgical consult. Nora kept her eyes on the monitor. Tell him Sergeant First Class Damon Reyes authorized it by being alive and requiring surgery. Ortega looked like he was deciding whether that was a real answer. Go, Nora said. He went. She spent the next 6 minutes doing the things that needed doing. Managing the fluid rate at the minimum necessary to maintain pressure without further diluting the blood's clotting capacity, keeping Reyes responsive with intermittent verbal checks, and making sure the information she was giving the nurses who were assisting her was clear enough to be actionable and concise enough to not slow them down. The nurses were fine, both of them. A woman named Torrance and a man named Park, both mid-level, both clearly capable, both also watching Nora with the particular attention of people who had figured out that something unusual was happening and were deciding how to position themselves relative to it. Torrance caught Nora's eye at one point and said, very quietly, "What do you want for the OR handoff?" Nora told her. Precise, ordered, the exact information a surgical team would need in the sequence they would need it. Torrance wrote it down without asking her to slow down or repeat herself. "You've done OR handoffs before," Torrance said. Not quite a question. "Once or twice," Nora said. The surgical team was in the OR at 6 minutes and 40 seconds. They took Reyes at 6:51. Nora watched the gurney go through the doors, and then she stood in the empty trauma bay with the fast ultrasound probe still in her left hand, and the gel drying on her glove, and the monitor still showing the last recorded vitals because nobody had cleared it yet. Valdez appeared beside her. "He's going to make it," Valdez said. It was not quite a question either. "If the hepatic laceration is what I think it is, and if the surgical team is competent, yes." Nora set the probe down on the cart. He would have been in cardiac arrest within the hour if they'd kept him on the sepsis protocol. Valdez was quiet for a moment. "We tracked you here through your nursing license registration," she said. "I want you to know that. We weren't monitoring you. We just needed to find you fast. I know how it works." "Nora." Nora looked at her. "You should come back." Valdez's voice was even, professional, but there was something underneath it that was less official than the words. "I'm not saying that as a recruitment pitch. I'm saying it because what you just did in 8 minutes with zero preparation and an incompetent setup around you. There are people who need that." "There are people here who need it too," Nora said. "They just don't know that yet." She pulled off her gloves and dropped them in the biohazard bin. "I need to go write an incident report before someone else tells this story wrong," she said. She left Valdez in the trauma bay. The corridor outside the ER was brighter than she remembered it being when she'd come in. The morning light had shifted, sunrise properly arrived, and the hospital had moved into its daytime rhythm. The particular accelerated pace of a facility that was always slightly understaffed trying to manage the volume of a day that had already started with an emergency it hadn't expected. She was halfway to the supply room when Darlene Marsh appeared from the administrative corridor. The expression on Darlene's face went through several distinct phases in approximately 3 seconds: confusion, recognition, and then a settling into something harder and more intentional. "What are you doing in the trauma wing?" Darlene said. "I was called in." "By who? You're on supply rotation. You have no clinical authorization in the trauma." "The patient is in surgery." Nora kept walking. "The surgical team has the handoff. Nurse Torrance has the documentation." Darlene stepped sideways, positioning herself in the corridor. Nora stopped. "You need to explain to me right now what happened in that trauma bay," Darlene said, "because I just had 3 military personnel walk through my ER without any administrative notification, and my charge nurse is telling me you were running a trauma assessment, and that is so far outside your authorized scope that I don't even have language for—" "A patient presented with undiagnosed internal hemorrhage," Nora said. "He had 40 minutes. I used 12 of them. He's in surgery now." "You are a supply nurse." "I'm a nurse," Nora said. The supply part was your designation. Something flickered in Darlene's face. Anger, but underneath it, something else. The specific unease of someone who has just realized they may not have the complete picture of the situation they're trying to control. "I want you in my office in 20 minutes, Darlene said, "and I want those soldiers out of my hospital. Those soldiers will leave when they're satisfied that their colleague is receiving appropriate care," Nora said. "I'd suggest not making that harder than it needs to be." She walked around Darlene. She didn't run. She didn't look back. She went to the supply room, her room, the place she had spent 7 months learning to think of as sufficient. And she sat down in the chair behind the door, and she pressed the heels of her hands against her eyes, and she stayed there for exactly 90 seconds. Then she got up. She had an incident report to write. She had it finished in 23 minutes, detailed and precise, written in the clinical language she had learned in a military medical training program that would make most civilian nursing programs look underprepared by comparison. She documented every decision she had made, every clinical indicator she had observed, the timeline from arrival to surgical handoff, and the rationale for each intervention. She named Ortega accurately, confused initially, but functional once oriented. She named Torrance and Park as competent. She did not name Preston Hale, because Preston Hale had not been present. She submitted the report through the hospital's incident reporting system and then went back to the supply room and started her normal morning inventory, because the morning inventory still needed doing and she was still employed here for another 29 days, and she was not going to give Darlene Marsh the satisfaction of finding her sitting idle. She was doing the IV bag count when Preston appeared in the doorway. He was still in his street clothes, not yet changed into scrubs, which meant he'd come in specifically for this rather than being pulled off a shift. His tie was slightly off-center. He had driven here fast. "I heard you ran a trauma assessment this morning," he said. Nora counted the last of the IV bags. "I identified a hemorrhaging patient and provided interim stabilization until the surgical team was ready. That's not what you're employed to do." The patient didn't have time for that distinction. Preston crossed his arms. He had the kind of face that defaulted to authority when it was challenged, jaw set, chin up, the posture of someone accustomed to being the most medically credentialed person in any disagreement. "You've been a problem since you got here. You don't know your place." Nora looked at him. "I know exactly where I am," she said. "I'm the person who catches what you miss." The color shifted in his face. "I want her on administrative leave pending review," Preston said, and it took Nora a moment to realize he was talking to Darlene, who had apparently been standing just outside the supply room door. Darlene stepped into the doorway. "I think that's the appropriate course of action," Darlene said. Nora set down the inventory clipboard. "You should know," she said, looking at both of them, "that the military personnel who came in this morning are not going to simply go away. They'll want to know the outcome of the patient's care. They'll want documentation. And they will notice if that documentation has been altered or if the timeline has been adjusted." A silence. Preston's jaw worked. "I'm not suggesting anyone alter documentation," Darlene said carefully. "I'm saying you overstepped your authorized scope, and that requires administrative review." "Then review it," Nora said. "I'll be in the supply room." Preston left. Darlene stayed in the doorway for a moment, and in that moment, something happened that Nora hadn't expected. Darlene's expression shifted. Not softened, not apologetic, but uncertain in a way that was different from the institutional certainty she always wore. Like she had caught a glimpse of something that didn't fit the picture she had built. Then she left too. Nora went back to the IV bag count. She was on the third shelf when Torrance appeared. "The patient's out of surgery," Torrance said. "Hepatic laceration grade 3. They got it. He's in recovery." Nora exhaled. "Surgeons say whoever identified the bleed and held him stable probably saved his life," Torrance added. "The surgical team did the work." "Yeah." Torrance leaned against the doorframe. "For what it's worth, but I've been here 6 years. I've never seen anyone run an assessment like that. That wasn't nursing school. That wasn't even ER training." She paused. "That was something else." Nora didn't answer. Torrance nodded once, like she hadn't expected an answer, and wasn't offended by the lack of one, and left. The rest of the morning was quiet. Too quiet. Nora recognized the specific quality of the silence, the way conversations dropped when she walked through a hallway, the way people looked and then didn't look. And she understood that the story of what had happened in the trauma bay was moving through the hospital, the way stories moved in closed institutions, fast and distorted, and already beginning to calcify into a version that served whoever was telling it. She heard fragments. "Doesn't even have trauma privileges. Who called her in? Nobody knows. Darlene's talking to legal." She ignored all of it. At noon, she went to the cafeteria, got coffee and a sandwich she mostly didn't eat, and sat at the corner table she had used for 7 months, the one with the slightly uneven leg that she had long ago learned to brace with her left foot. Major Valdez sat down across from her at 12:17. She was out of her kit now. Civilian clothes, which somehow made her look more, not less, military, with a phone on the table and the look of someone who had spent the morning making calls. "He's stable," Valdez said. "I know. He's asking for you." Nora picked up her coffee. "He shouldn't be talking. He's Reyes. He was asking for you before they had him fully under in pre-op." Valdez folded her hands on the table. "I talked to the hospital administration this morning. A woman named Marsh." Nora set the coffee down. "She told me you were being reviewed for unauthorized clinical activity and that your employment contract was already under consideration for non-renewal." Valdez's voice was measured. "I want you to know what I told her." "What did you tell her?" "I told her that Sergeant First Class Reyes is a decorated special operations soldier and that the care he received this morning would be the subject of a formal after-action review, and that any institutional decision affecting the person who provided that care would be noted in that review." Valdez paused. "She didn't say much after that." Nora looked at her. I'm not asking you to fight my battles, Nora said. I'm not fighting your battles. I'm stating facts. Valdez picked up her own coffee. You know what the review is actually going to show? I have a general idea. It's going to show that a patient with a life-threatening abdominal hemorrhage was on an incorrect treatment protocol for 40-plus minutes, and that the only intervention that changed his trajectory was performed by the person this hospital had assigned to count medical supplies. Valdez set the cup down. That's going to be in writing, with a case number, and it's going to land on some desks that Darlene Marsh does not want it to land on. The cafeteria noise continued around them, the particular ambient sound of a hospital midday, trays, chairs, a television in the corner on low volume. She's going to try to move first, Nora said, before the review is finalized. She's going to try to document this morning as an unauthorized scope violation and get me out of the building before anyone can look too closely at the sequence of events. I know. So do I. Nora was quiet for a moment. I've been in environments where people moved first when they felt cornered. It doesn't always go the way they plan. No, Valdez said. It doesn't. She left 20 minutes later. Nora went back to the supply room. The afternoon passed in the way. Afternoons passed when you were waiting for something and trying not to show it, steadily, with the kind of attention to small tasks that was really a way of managing the larger thing you couldn't do anything about yet. She was finishing the afternoon restock when the supply room phone rang. Internal line. She picked it up. Vasquez. A pause. Not Darlene's voice. The administrative man from before, the one with the lanyard and the pre-decided expression. His name was Burrell. There's a meeting tomorrow morning, 8 a.m., administration conference room, 3rd floor. We're requesting your presence. Am I permitted to bring documentation? A slightly longer pause. You may bring whatever you feel is relevant. Thank you, Nora said. She hung up. She stood in the supply room for a moment. Then she pulled out her phone and made a call of her own. Not to Valdez, not to anyone in the military chain, but to a woman named Suki Perot, who worked for a nurse advocacy organization in the state capital, and who had, on 2 previous occasions in her career, helped other nurses navigate exactly this kind of institutional machinery. The call lasted 11 minutes. When it ended, Nora knew 2 things she hadn't known before. The first was that Darlene Marsh had filed a formal scope violation report at 9:17 that morning, less than 3 hours after the Trauma Bay incident, and that the report had been submitted not just to hospital administration, but directly to the state nursing board. The second was that someone had already called the nursing board on Nora's behalf, before Nora had even known the report existed. She didn't know who had made that call, but she had a fairly clear idea. She was driving home at 6:45 when her personal phone rang again, same number as that morning, the one she hadn't expected to see. She answered. The after-action report is being flagged for review by the Inspector General's office, the voice said. No greeting. They had never done greetings. Not because of anything you did wrong, because of what they found when they looked at Reyes's intake documentation. Nora kept her eyes on the road. What did they find? Someone altered the initial assessment timestamp. She was quiet. The original intake time is in the system at 5:43 a.m., the voice said. But someone changed the clinical assessment entry to show 6:22, 40 minutes missing. 40 minutes during which Reyes had been on the wrong protocol. 40 minutes that, if the documentation had been accurate, would have made very clear how long the incorrect diagnosis had been in place before Nora had corrected it. Who? She said. We don't know yet, but we will. A pause. Nora, tomorrow's meeting. Don't go alone. The call ended. She sat with it for the rest of the drive, the specific weight of it, the particular way this had just shifted from a workplace dispute into something with harder edges and longer reach. Someone had altered documentation, not to cover a mistake, to cover the fact that a mistake had been made and that the mistake had been allowed to continue for 40 minutes while a patient deteriorated, and that the person who had corrected it was a supply nurse who wasn't supposed to be there, and that if the correct timeline became visible, the question of who had been responsible during those 40 minutes would have a very clear answer. She pulled into her apartment parking lot and sat in the car for a moment. Then she went inside, made coffee she didn't need, and opened her laptop. She had a document she had kept for 7 months. Not a complaint, not a formal report, Just a running record of dates and incidents and the things she had observed that she had not reported because reporting them through official channels had not been safe. The chest that needed tracheal check. The medication dosage discrepancy. The time she had flagged a crashing patient's respiratory rate to a resident who had not acted on it for 9 minutes. She had written them down because she had learned a long time ago, and not in a hospital, that documentation was the difference between truth and rumor. She read through it carefully. Then she added the events of that morning, all of them. The timestamp on her entry was 7:18 p.m. She saved the document, encrypted it, and sent a copy to Suki Perot's secure line. Then she closed the laptop and stood at her kitchen window looking out at the parking lot and the streetlights coming on in the early dark of a Wyoming evening. And she thought about Damon Reyes in a recovery room somewhere in this building with a drain in his abdomen, and one fewer mystery about why the supply nurse had known what to do. She thought about what Valdez had said. You should come back. She thought about Darlene's face in the supply room doorway. She thought about the altered timestamp, 40 minutes. Someone had needed those 40 minutes to disappear, and they had made a mistake that people who acted from fear and institutional habit almost always made. They had assumed the person they were trying to erase didn't know how to fight back. Tomorrow morning, 8 a.m., administration conference room, 3rd floor. She went to bed at 9:30 and lay in the dark. And the thing she felt was not fear exactly. She had stopped being afraid of institutions that underestimated her a long time ago in a very different context, but something sharper and more specific. Anticipation. The kind that came just before the moment when everything that had been quiet and patient and carefully withheld was about to become impossible to ignore. Her phone buzzed on the nightstand. A text from a number she didn't recognize, but the message was only 4 words, and she understood immediately who had sent it. They know who you are. She did not sleep after the text. She lay in the dark for 40 minutes, running the sentence through her mind the way she had once been trained to run threat assessments, not with panic, but with the particular analytical stillness that made panic useless. They know who you are. 4 words. No signature. A number she didn't recognize, which meant either someone with resources who didn't want to be traced, or someone inside the hospital who had access to a burner and a reason to warn her. The warning itself told her something important. Whoever sent it believed the knowledge was dangerous, which meant whoever they were, Darlene, Preston, Burrell, some combination of administrative machinery she hadn't fully mapped yet, they intended to use it in a way that went beyond a standard scope violation review. She got up at 4:30, made coffee, and sat at the kitchen table with her laptop and the encrypted document and the particular focused quiet of someone who had done pre-mission preparation before and knew the difference between the things she could control and the things she could not. She could control the documentation. She could control what she walked into that room with tomorrow morning. She could control whether she was surprised. By 6 a.m., she had organized 7 months of incident records into a clean, dated, cross-referenced document, the kind of document that would take a formal review board approximately 15 minutes to understand and significantly longer to argue with. She sent it to Suki Perot's secure line with a message that said, "Meeting at 0800. I'll call you after." She dressed for the meeting the way she had once dressed for certain briefings. Not to impress, but to be taken seriously in a room that would be looking for reasons not to. She drove to the hospital. The administration conference room on the 3rd floor had a long oval table, 6 chairs, a projector screen nobody had turned on, and a window that looked out over the hospital's north parking lot where 2 of the military vehicles were still parked, which Nora noticed and which she suspected nobody else in the room had considered significant. Burrell was there. A woman from HR whose name tag said Calloway. A man Nora didn't recognize, that 50s, suit, the specific quality of stillness that came from legal training rather than military training. And Darlene Marsh, seated at the far end of the table with a manila folder and the expression of someone who had decided how this meeting ended before it began. Preston Hale was not present. That was interesting. "Ms. Vasquez," Burrell said, "please sit down." She sat. "We'll be recording this meeting," Calloway said, and set a small digital recorder on the table. "That's fine," Nora said. "I'm doing the same." She placed her own phone on the table, already running. She watched the legal man's eyes move to it and then away. Burrell cleared his throat. "As you know, this meeting concerns the events of yesterday morning, Specifically, your unauthorized clinical intervention in Trauma Bay 2. I provided interim stabilization to a patient in acute hemorrhagic crisis, Nora said. The patient is alive and out of surgery. I'm happy to discuss any aspect of the clinical decisions I made. That's not, Darlene started. Let me finish, Burrell said with the weary authority of a man managing multiple difficult personalities in a single room. The scope violation has been documented and submitted to the State Nursing Board. That process will proceed independently of this meeting. He folded his hands. What we're here to discuss is the broader question of your employment and, he glanced at the legal man, certain information that has come to our attention regarding your background. Nora waited. The legal man spoke for the first time. His voice was practiced, precise. Miss Vasquez, we've been made aware that your military service record includes a period of classified assignment. We've also been made aware that your nursing license registration lists a specialization in emergency and trauma care that was not disclosed during your hiring process. I was hired for a supply rotation, Nora said. The job posting didn't ask for specializations. It's a matter of disclosure, he said. When you interviewed, I answered every question I was asked, she said, accurately. A pause. The concern, Burrell said carefully, is that you may have misrepresented your qualifications in a way that allowed you to be placed in a role that I was overqualified for, Nora said. The room went quiet. That's not a misrepresentation, she said. That's a hiring decision. I applied for the position that was available. I performed the duties I was assigned. I also, on multiple occasions over 7 months, identified clinical errors that were either ignored or resulted in complaints against me for overstepping. She opened the folder she had brought. I have documentation of each of those incidents, dates, times, the nature of the concern I raised, and the response I received. Darlene's expression shifted. That documentation, Nora continued, also includes the September 15th incident in which I identified a medication dosage discrepancy in the crash cart records, reported it through the secondary intake system, and was subsequently told by the charge nurse that my role did not extend to medication management. The discrepancy was quietly corrected 2 days later without acknowledgement. The legal man was very still. And the October 3rd incident, Nora said, in which I observed a patient in Trauma Bay 3 presenting with signs consistent with tension pneumothorax and brought it to the attention of the attending physician, who declined to act on the information. The patient's condition required emergency intervention approximately 4 minutes later. She looked up. That attending physician was Dr. Preston Hale, she said, who is not in this room today. Burrell looked at Calloway. Calloway looked at her folder. Darlene's jaw was set so tight it was doing structural work. I'm not here to make anyone's life difficult, Nora said, and meant it, and also understood that the two things were no longer separable. I came to this hospital because I wanted a quiet job. I did the quiet job. The problem is that I kept seeing things that needed to be said, and the response to that, every single time, was to find a way to make me smaller. She closed the folder. Yesterday morning, a man's life depended on someone knowing what I know. I would make the same decision again in the same circumstances. Burrell rubbed the back of his neck. Darlene leaned forward. You had no authorization to... Darlene. The legal man's voice was not loud, but it stopped her the way a hand signal stops traffic. He looked at Nora. Ms. Vasquez, I'd like to take a 10-minute recess. Of course, Nora said. She waited in the hallway. She checked her phone. A message from Suki Perot. Nursing board contacted us this morning. Someone filed a response to Marcia's complaint before we did. Do you know a Major Valdez? Nora looked at the message for a moment. Then she typed back, yes. She was still in the hallway when Torrance appeared from the stairwell. Not by accident, by the look of it. Torrance had the energy of someone who had been waiting for a specific moment. There's something you need to know, Torrance said, keeping her voice below the ambient noise of the corridor. Park found it last night. He was pulling the trauma bay logs for the standard 24-hour review, and he noticed the timestamp discrepancy, the intake time versus the first clinical assessment entry. I know about that, Nora said. Torrance stopped. You know? 40 minutes missing. Torrance stared at her. How? It doesn't matter. What did Park do with it? He flagged it to the charge supervisor. I don't know what happened after that, but Nora... Torrance's voice dropped further. The change was made from Darlene's system login. The hallway felt very still for a moment. He's sure? Nora said. The access log doesn't lie. Her credentials, her timestamp, 6:41 a.m. Torrance looked at the conference room door. That's 40 minutes after the military brought Reyes in, and about 15 minutes after you stabilized him. After the crisis was over. After Nora had demonstrated exactly what the record would show, if the record was accurate. Someone had looked at those 40 minutes and understood what they meant, and had done the only thing that seemed in that moment like it could make them disappear. Thank you, Nora said. Don't thank me. Just… Torrance hesitated. Whatever's happening in that room, don't let them talk you out of what you know. She left. Nora stood in the hallway until the conference room door opened and Burrell appeared. We're ready, he said. She went back in. The meeting lasted another 22 minutes and ended without resolution in either direction, which was itself a kind of resolution. The legal man had clearly advised against making any immediate decisions, and Burrell had accepted that advice, and Darlene's controlled fury was the most significant thing in the room by the end of it. Nora's employment status remained unchanged pending further review. The scope violation report to the nursing board remained filed. Everything was, officially, in process. Which was another way of saying that the ground was shifting under everyone's feet, and nobody wanted to be the person who moved first. Nora went back to the supply room. She inventoried 4 shelves of wound care supplies and 2 shelves of catheter equipment, and she thought about the 40 missing minutes and Darlene's system login and what it meant that someone had been frightened enough to do that, and what it meant that the access log existed. She was labeling a case of sterile drapes when Ortega appeared in the supply room doorway. He was still in his scrubs from the previous day, which meant either he'd worked overnight or he hadn't gone home, and his expression had the specific quality of someone who had spent a long time thinking about something and had arrived at a position he wasn't comfortable with. I wanted to say something, he said. Nora kept labeling. I've been going over the intake assessment from yesterday. He leaned against the doorframe. I missed it. The fast, I was in the sepsis algorithm, and I wasn't looking outside it. You were working with the information you had, Nora said. I was working with incomplete information because I didn't take enough time to build a complete picture. He was quiet for a moment. Where did you train? She looked at him. I'm not going to push, he said. Whatever program produced what you did yesterday morning, I want to know it exists. I wasn't trained in a program you can attend, she said. He nodded slowly, not satisfied, but accepting. Okay. He straightened. For what it's worth, I'm going to write an accurate account of what happened in that bay. For the incident review. I just wanted you to know that. Thank you, she said. He left. The rest of the morning passed in pieces. Small interactions, shifted atmospheres, the particular social texture of a building that was processing something it didn't have language for yet. People who had never spoken to her stopped in the corridor. People who had spoken to her only to direct her somewhere now made eye contact in a different way. She recognized it. She had seen it before, in different contexts, when the balance of a situation had changed, and the people in it were recalibrating. At 11:15, her personal phone rang. Valdez. I'm outside, Valdez said. The main entrance. Can you come down? She went. Valdez was standing by the military vehicles with a man Nora hadn't seen before. Civilian clothes. But the posture was federal, the specific kind of alert neutral bearing that wasn't military and wasn't local law enforcement, but was something in between. This is Special Agent Drummond, Valdez said. Inspector General's office. Drummond extended a hand. Ms. Vasquez, thank you for coming down. What's happening? Nora said. We've identified the timestamp alteration in the patient intake records, Drummond said. It was matter of fact in the way that people who dealt with institutional misconduct learned to be. Not cold, but calibrated, the emotional temperature of someone who had learned that neutrality produced better information. We're going to need a formal statement from you about the sequence of events yesterday morning, start to finish. I have documentation. We'd like both. He paused. I want to be transparent with you. This started as a routine after-action review of Sergeant Reyes's care. It is no longer routine. He glanced at Valdez, then back at Nora. The altered record, combined with the history of complaints that have been filed against you and subsequently removed from your personnel file. Nora went still. Removed? She said. Drummond looked at her steadily. 3 formal incident reports filed over the last 7 months by other nursing staff, corroborating events similar to those in your own documentation. All 3 were marked resolved and removed from the active complaint system. We don't yet know who authorized the removal. 3 reports. 3 separate people who had seen what she had seen and documented it and had their documentation disappear. She had been so focused on staying invisible that she hadn't considered that other people had been paying attention, that other people had tried through official channels to say the same things she had been saying through back channels and cautious workarounds. "When do you need the statement?" she said. "This afternoon, if possible. We've arranged a space." The hospital's main entrance doors opened behind her. She heard Darlene's voice before she turned, clipped, controlled, the tone she used when she was performing authority for an audience. "Ms. Vasquez, you're needed inside." Nora turned. Darlene was standing in the entrance with Burrell beside her and Preston Hale behind them both, and there was something in the configuration of the 3 of them that read less like an administrative summons and more like a strategic position. Then Nora saw who was behind Preston, a man she hadn't expected. The hospital's chief medical officer, Dr. Garrison Webb, who was almost never on the floor, who operated from the administrative wing on the 4th floor, and whose presence in the main entrance of a Tuesday morning meant that someone had escalated this to a level that Darlene and Preston had not originally intended. Drummond said quietly, from behind her, "Dr. Webb is on the IG's contact list for this facility." Nora filed that. She turned to Drummond. "This afternoon," she said. "I'll give you the full statement." She walked toward the entrance. She walked past Darlene without stopping and past Preston without looking at him. And she met Dr. Webb's eyes as she came through the door. And Webb was looking at her with the expression of a man who had received several very different accounts of the same events and was in the process of deciding which one aligned with the evidence. "Ms. Vasquez," as Webb said. "Dr. Webb, I'd like a word." He gestured toward the corridor that led away from the administrative wing, not up, not toward his office, but sideways toward the main floor. "Walk with me." She walked with him. Preston made a move to follow, and Webb said, without looking back, "Just us, Preston." And Preston stopped. They walked in silence for a moment, past the information desk, past the elevator bank, into a quieter section of corridor near the chapel waiting area that nobody was using. Webb stopped. He was 62, heavyset, with reading glasses pushed up onto his head, and the look of someone who had been in medicine long enough to have seen the institutional machinery do things he wasn't proud of, and hadn't always had the standing or the courage to stop. "I've been briefed by the IG's office," he said, "and I've reviewed the intake logs from yesterday morning." Nora waited. "I've also reviewed Sergeant Reyes's surgical report. The team noted that the preoperative stabilization was, and I'm quoting, unusually precise given the reported field conditions." He looked at her. "You held that man's pressure for 12 minutes with what was available in a trauma bay that wasn't set up for that presentation, and you did it in a way that gave the surgical team a viable patient to work with." "He made it through," she said. "He did." Webb took his glasses off his head and turned them in his hands. "I need to ask you something directly." "Okay." "Did Darlene Marsh or Preston Hale, at any point in the last 7 months, take action to prevent you from practicing at the level of your training?" The corridor was quiet. Outside, through the window at the end of the hall, the morning had turned bright and flat, and the parking lot was visible, and the 2 military vehicles were still there. "Yes," Nora said. Webb put his glasses back on his head. "Okay," he said. He was quiet for a moment longer, and in that quiet she could see the particular weight of an institutional leader who was about to make a decision with consequences that would travel beyond this conversation. "I want to be honest with you," he said. "I don't know the full picture yet. I don't know what the IG review is going to find, or what the nursing board process will produce, or whether there are aspects of this I haven't been told." He looked at her. "But I know what the surgical report says, and I know what the access logs show. And I know that a man is alive who should not be, by any reasonable projection of where he was heading at 6 a.m. yesterday morning." Nora said nothing. "Stay in the building today," he said. "Don't go to the supply room. He stopped. "I'm reassigning your duties for the remainder of the day pending a full review of your personnel file and your clinical history. You'll be in the department supervisor lounge on 2. I'll have someone bring you what you need. She looked at him. I'm not suspending you, he said. I'm making sure you're somewhere I can reach you. She thought about the difference. All right, she said. She spent the next 3 hours in the department supervisor lounge, which was a small room with 2 couches, a coffee maker, and a window that looked out over the hospital's internal courtyard. She gave her formal statement to Drummond at 1:30, 94 minutes, recorded, with her documentation as a supplement. He was thorough and unhurried and asked exactly the questions she would have asked in the same position. At 3 p.m., Suki Perot called. The nursing board received a counterfiling this morning, Suki said, signed by Major Elena Valdez, U.S. Army, with attached documentation of Sergeant Reyes's care timeline and a formal commendation for your clinical decision-making. They also received, and this is new, a signed statement from Dr. Ortega supporting the accuracy of your assessment. Nora exhaled. The scope violation complaint is still active, Suki said, but the board is now treating it as contested. They'll want a formal hearing. A pause. How are you holding up? I'm fine, Nora said. That's what people say when they're not fine. I know, Nora said. I'll call you after the hearing is scheduled. She hung up. She was on her second cup of coffee from the lounge's ancient maker, when the door opened and Torrance appeared, and Torrance's face told her something had shifted before she said a word. What happened? Nora said. Reyes is asking to see you. Torrance stepped into the room. He's been awake for about an hour. They moved him to a recovery room. She stopped. He's pretty insistent. Nora set the coffee down. There's something else, Torrance said. Tell me. Preston just went upstairs to Webb's office, like 5 minutes ago, and his face was… She searched for the word. He looked like a man walking into something he knows is not going to go well. Nora stood. And Darlene hasn't been seen since noon, Torrance added. Her office light is off. Nora processed this. An IG investigator in the building. A CMO who had asked the right questions. A surgeon who had gone upstairs looking like a man headed for a reckoning. An administrator who had gone quiet. The ground was still shifting. She went to the recovery room. Damon Reyes was in bed 7, inclined at 30 degrees, with a drain and 2 IV lines, and the controlled expression of a man managing a significant amount of pain with the particular stillness of someone trained not to telegraph it. He looked worse than she had hoped, which was still better than she had expected given where he'd been at 6 a.m. the previous day. He looked at her when she came in and said, without preamble, "They're going to try to use me." She sat in the chair beside the bed. "What do you mean?" "Darlene Marsh." His voice was careful, the measured cadence of someone on pain management who was being deliberate about every word. "Someone from hospital administration came to my room this morning, before the IG got to the building, told me that the military's involvement in a civilian hospital raised protocol questions and that…" He stopped. "They were feeling me out, seeing if I'd say the care I received was appropriate, whether I'd signed something saying the intervention was invited." Nora was very still. "Invited," she said. Like the military had requested civilian clinical support and the hospital had authorized it, which would make what you did an institutional act instead of an individual one. And it would make the question of your scope of practice, he paused, moot. She understood immediately. If the record showed that Cascade Ridge had formally authorized military-requested clinical support, Nora's intervention became institutional rather than individual. The scope violation complaint collapsed, but so did the liability question for the 40 minutes of incorrect treatment, because an authorized military consultation would reset the documentation timeline. It was not a clean cover. It had too many moving parts, too many people who already knew the real sequence. But it was the kind of institutional maneuver that worked when everyone involved was tired and no one wanted the longer fight. "What did you tell them?" she said. Reyes looked at her. "I told them I needed to speak to the Inspector General's office before I signed anything," he said. "And then I had the nurse call Drummond." She held his gaze. "Good," she said. "Yeah." He shifted slightly against the pillow. "Vasquez, why are you here? At this hospital? Really?" She thought about how to answer. "I was trying to be done," she said, "with the version of myself that knew how to do what I did yesterday." "And?" "And it turns out that version doesn't disappear just because you want it to," she said. I was quiet for a moment. "No," he said. "It doesn't." She stayed for 12 more minutes until the nurse came for the afternoon vitals check, and then she walked back toward the supervisor lounge, and she was passing the second-floor nursing station when she heard it. Raised voices. Preston's and Webb's, from behind the closed door of the small consultation room at the end of the corridor. She didn't stop. She kept walking, and then she heard a third voice, not Webb's, not Preston's, a voice she recognized as Drummond's, measured and procedural, carrying through the door with the specific authority of someone reading something aloud from an official document. She heard, clear and distinct through the gap under the door, 4 words that changed the shape of everything. Alteration of medical records. She kept walking. She made it back to the supervisor lounge and sat down and picked up the cold coffee and held it in both hands. And outside the window, the courtyard was in afternoon light now, longer shadows, the day tilting toward evening. Her phone buzzed. A message from Valdez. IG has referred to DOD counsel. This isn't staying local. She read it twice. Then a second message from the same unknown number that had sent the 4 words the night before. This one had 5. Preston just gave Darlene up. She put the phone down on the cushion beside her and looked at the courtyard window and did not move for almost a full minute. Preston had given Darlene up. She turned that over carefully, the way you turned something over when you needed to understand its weight before you decided what to do with it. Preston Hale was not the kind of man who made that kind of move out of conscience. He was the kind of man who made it out of calculation, who had sat in that consultation room with Drummond reading from an official document and had done a very fast assessment of where the weight was distributed and had decided that the person holding the most exposure was not himself. The timestamp alteration had been made from Darlene's login credentials. Preston had almost certainly known that. And the moment the IG investigator put that fact on the table, Preston had understood that his best position was on the side of the people asking questions rather than the side of the person whose name was on the access log. It was not courage. It was arithmetic. Nora picked up the phone and texted Suki Perot. Something is breaking. Stay available. Then she sat and finished the cold coffee and thought about the shape of what was happening. Not with satisfaction, because satisfaction required a kind of distance from the situation that she didn't have yet, but with the particular focused attention of someone watching a structure fail and needing to understand exactly how it was going to come down. The door to the supervisor lounge opened at 4:47, Dr. Webb. He closed the door behind him and sat on the couch across from her, and he looked older than he had this morning in the way that people looked older after they had spent several hours managing something that required them to be the largest version of themselves. Preston Hale has provided a voluntary statement to the IG investigator, Webb said. I know, Nora said. He looked at her briefly, moved on. He states that Darlene Marsh instructed him, on 3 separate occasions over the past 7 months, to document complaints against you in a way that would support non-renewal of your contract before your military background could be verified by hospital administration. The room was quiet. She knew, Nora said. She found out approximately 6 weeks after you were hired. Preston doesn't know how. He says she came to him with information about your service record, partial information, not the classified portions, and told him that if your full background became visible to administration, there would be questions about why a combat-trained trauma specialist had been placed on supply rotation by her department. Nora thought about that. 6 weeks in. She had been there 6 weeks when the atmosphere had started to shift, when the complaints had started, when the small corrections had started generating formal responses instead of being absorbed quietly. She had thought, at the time, that she was simply becoming more visible, that the introductory period had ended and people were paying closer attention. It hadn't been that. Darlene had known. And Darlene had been managing the situation the way she managed everything, with institutional machinery, with documentation, with the incremental application of administrative pressure designed to produce an outcome before anyone could look too closely at the process. She was afraid of the liability, Nora said. Webb nodded. If it became clear that an administrator had placed a nurse with your training history on supply rotation and then systematically suppressed her clinical contributions, the question of every patient outcome during that period becomes significantly more complicated. Every patient, every incident Nora had logged, every correction that had been dismissed, every patient who had been treated without the benefit of what she had been seeing and had been told to stay out of. How many of those incident reports were removed, she said. 5, Webb said. Not 3. We found 2 more this afternoon. 5 people. 5 separate staff members who had put something in writing and had watched it disappear. She pressed the heels of her hands against the edge of the couch cushion and held that number in her mind and did not let herself look away from it. What happens now? She said. The IG investigation continues. Drummond has requested Darlene's full administrative access logs going back 14 months. That's when she was promoted to ER supervisor. We'll know by tomorrow morning how far the record alteration goes. Webb leaned forward slightly. I've suspended her pending investigation, effective this afternoon. Preston has been placed on administrative leave pending review of his patient documentation over the same period. Nora looked at him. The scope violation complaint, she said. I've contacted the nursing board directly, Webb said. I've provided them with the after-action report from Sergeant Reyes's care, Drummond's preliminary findings, and a formal letter from this institution withdrawing institutional support for the complaint as submitted. He paused. I can't guarantee the board's response. They operate independently. But I've made our position clear. Which is? That the complaint was filed in a context of documented institutional misconduct, and that the clinical judgment you exercised in Trauma Bay 2 was consistent with the standard of care given the patient's presentation and the time constraints involved. He took his glasses off his head and held them. I am not going to tell you this process is going to be clean or fast. I can tell you that this hospital is not going to stand behind that complaint. She nodded. I owe you an apology, Webb said. She waited. I was briefed twice in the last 2 months about staffing concerns in the ER department. Vague language, nothing specific, but there was enough there that I should have looked more closely. He turned the glasses in his hands. I didn't. I had budget negotiations and a facility audit, and I let the ER administration brief me and move on. He looked at her directly. A man nearly died because of that. I'm not going to dress it up. The apology was real enough that she didn't know immediately what to do with it, which was its own kind of information about how rarely she had received genuine ones. He didn't die, she said. No, Webb said. He didn't. He left 10 minutes later. She stayed in the supervisor lounge until 5:30, when Torrance appeared again. Torrance had apparently appointed herself Nora's unofficial information relay, which Nora was not going to object to. With an update that Darlene had left the building at approximately 4 p.m., escorted to her office to collect personal items, and then out by a route that avoided the main ER floor. People saw, Torrance said. Word travels. The overnight nursing staff already knows. What are they saying? Nora said. Torrance considered. A lot of things. Some people are angry at Darlene. Some people are angry at the military for showing up and upending everything. Some people are... She paused. Some people are asking why they didn't look at your file when you were hired, why nobody asked what the gap was. Because nobody wanted to, Nora said. Not bitterly, just as a fact. A supply nurse with a gap in her record is easy. She stocks shelves and she doesn't cause problems, and nobody has to think about what she was doing before. Torrance was quiet for a moment. For what it's worth, she said, I'm sorry I didn't ask. Nora looked at her. You were the first person in 7 months who ran alongside me in that trauma bay without asking if I was authorized to be there, Nora said. That's worth something. Torrance nodded once, accepted it, and left. Nora gathered her things and drove home. She made dinner, actually made it, pasta from scratch, which she did when she needed to put her hands to work on something with a clear and manageable outcome. And she ate at the kitchen table and called her sister in Tucson, who knew nothing about military service or trauma bays but who knew Nora, and who listened for 20 minutes without interrupting and then said, Are you actually okay, or are you okay adjacent? Adjacent, Nora said. Close enough, her sister said. Call me tomorrow. She slept better than she expected. She was back at the hospital by 7:15 the next morning, and the building felt different in the way buildings felt different when their internal weather had shifted. Same floors, same lights, same ambient noise, but the atmosphere altered, the particular social pressure of an institution that had spent the previous day processing a significant disruption and was now recalibrating around the new reality. People looked at her differently in the corridors, not all of them warmly. Some of the looks were complicated in ways she understood without needing to analyze, people who had been complicit in small ways, who had looked away from things they might have questioned, who were now navigating the discomfort of that. She didn't require their warmth, She required only that they do their jobs accurately, which was the same thing she had always required. Drummond met her in the second-floor conference room at 8 a.m. He had a colleague with him now, a woman named Ferris, same measured quality, introduced as a DoD compliance specialist. The shift from IG field investigator to DoD compliance specialist in 24 hours told her something about how fast this was escalating above the level of a single hospital's internal review. "We have preliminary findings from the access log review," Drummond said. "I want to walk you through them." He placed a printed summary on the table. She read it. Darlene Marsh had accessed the incident reporting system on 11 separate occasions over 14 months. 9 of those accesses had resulted in modification or deletion of filed reports. The 5 reports involving Nora's observations were among them. The other 4 predated Nora's arrival. Complaints filed by other staff about ER practices that had similarly disappeared from the active record. 11 accesses, 9 modifications. This was not a panicked response to an unexpected situation. This was a system. "She'd been doing this before I arrived," Nora said. "Yes," Drummond said. "The earliest deletion we found is from 22 months ago. A complaint filed by a nurse named Petra Okafor regarding unsafe patient handoff procedures in the ER. Nora didn't know Okafor. Probably gone by now, moved on, the way nurses moved on when the environment stopped being livable." "What does Preston's statement say about the earlier deletions?" Nora said. "He claims he wasn't aware of them. He knew about yours." Drummond's tone was neutral in the way that communicated his personal opinion of that claim without stating it. "He says Darlene told him the suppression was to protect departmental metrics, that complaints from nursing staff about clinical procedures were being used by administration in budget reviews, and she was managing the record to ensure the department's performance scores remained fundable." Performance metrics. The incident reports were affecting the department's budget numbers, so they had been removed. And the removal had been reframed as administrative management rather than misconduct, which was exactly how institutional wrongdoing survived as long as it did, by wearing the clothing of legitimate process. "Who else knew?" Nora said. "That's what we're still working on," Ferris said. It was the first time she had spoken, and her voice had the specific precision of someone who chose words for their legal weight. "We have reason to believe the ER department's anomalous metrics had been flagged in at least 2 internal audits over the past 18 months. Whether anyone above department level was aware of how those metrics were being maintained is a question the investigation is actively pursuing." Above department level. She looked at the table for a moment. She thought about Webb's apology, his briefings, the vague language, nothing specific, and how he had moved on. She didn't say anything. It wasn't her investigation. "What do you need from me today?" she said. "We'd like you to review the preliminary findings and confirm the accuracy of the timeline as it relates to your own experience," Drummond said. "And we have a request." She waited. "The DoD is conducting its own parallel review of Sergeant Reyes's care and transport," Ferris said. "As part of that review, your military service record has been flagged for administrative access by our office." She paused. "There are portions of your record that are classified at a level that requires separate authorization. We're not asking you to waive any classification protections. We are asking whether you consent to a limited summary of your medical training credentials being included in the formal IG report, specifically your certifications and clinical training history, not operational details." Nora thought about what it meant for that summary to exist in a document that would circulate through institutional channels. She thought about what it meant for it not to. "Yes," she said, "include it." The review took 2 hours. By the time she emerged from the conference room at 10:15, the hospital had received 2 external phone calls. She learned this from Torrance, who had an almost architectural understanding of how information moved through this building. One from a state health department inspector requesting documentation access, and one from a regional health system oversight office that had apparently seen a preliminary version of the IG's report and wanted clarification on the scope of the record alterations. The machinery was engaging, not fast, it was never fast, but the gears were turning, and once institutional machinery of this kind began turning, it produced a specific kind of momentum that was very difficult to reverse. She was in the second-floor lounge at noon when Park knocked on the open door. Park, the nurse who had found the timestamp discrepancy in the first place, was young, mid-20s, with the careful manner of someone who thought twice before speaking and usually found something worth saying. I wanted to give you something, he said. He held out a printed page. She took it. It was a copy of the incident report he had filed the night of the timestamp discovery. Her name was in the body of it, not as a subject, but as a witness to the timeline, documented accurately, with the exact sequence she had described to Drummond. I filed it in the secondary system, Park said, the same back channel you used for the medication discrepancy in September. I figured if someone was going to delete things from the main system, it was better to have a copy somewhere else. She looked at the report. September. He had known about the medication discrepancy. Known it had been her. You knew, she said. I found the secondary filing when I was doing a training audit in October, he said. Your name was on it. I looked up your intake paperwork. He paused. The employment gap and the redacted record. I didn't know what it meant, but I knew it meant something, and then the October complaint got filed against you and I… He stopped. I should have done more then. You did something now, she said. Yeah. He looked at the floor briefly. For what it's worth, a lot of the nursing staff are talking about what Darlene did, about the reports that were deleted. He looked back up. Okafor isn't the only one who left. There were 2 others. Both of them filed complaints that disappeared. 2 others she hadn't known about. People who had tried to make the institution respond and had been quietly erased from its record and had eventually left because there was nothing else to do. She thought about that for the rest of the afternoon with a particular kind of weight that wasn't grief exactly, but was adjacent to it. The specific heaviness of understanding the full scope of something that had been contained and managed and made invisible for a long time. At 3 p.m., Suki Perot called. The nursing board received the hospital's letter this morning, she said. They've scheduled a formal hearing for 3 weeks out, but the preliminary posture has shifted. With Webb's letter and the IG's preliminary findings attached, the complaint is being treated as contextualized rather than standalone. A pause. In plain language, they're not going to act against you before the hearing, and the hearing is likely to resolve in your favor given what's already documented. Likely, Nora said. Nothing is certain until the vote, Suki said, but I've seen these cases. I know what this documentation looks like. You're in a strong position. After she hung up, she went to the recovery wing. Reyes was more awake than he had been yesterday. Sitting up properly, the pain management dialed back, with the look of a man who was still not comfortable but was functional enough to be annoyed about it. Valdez was in the chair beside him, which was where Valdez had apparently been spending most of her time. You look better, Nora said. I look terrible, Reyes said. Tell me what's happening out there. She told him. The condensed version, the key facts, the things he needed to know as the patient whose care had been the trigger for all of it. He listened without interrupting, which was one of the things she had always valued about him. Darlene Marsh, he said when she finished. Yes. She altered my intake record. He said it flatly, the way operators stated things they found factually unacceptable. Yes. Because she was trying to cover the gap in treatment time. That's what the evidence indicates. He was quiet for a moment. I want to give a statement, he said, not just to the IG, to the hospital board, formally, as the patient whose care was affected. He looked at Valdez. Can we do that? We can do that, Valdez said. Nora started to say it wasn't necessary, that the investigation had enough, that the machinery was already moving, and then she stopped herself, because she understood what he was doing. It wasn't about the investigation, it was about the record, about the formal, institutional, documented record stating clearly that a specific patient had received inadequate care because of specific decisions made by specific people, and that the person who had corrected it had been operating under active suppression at the time. It was about making the erasure impossible. Okay, she said. She left them at 4:30 and was halfway down the corridor when her personal phone rang. Unknown number, different from the previous 2. She answered. Ms. Vasquez. A voice she didn't recognize, older, institutional, the specific register of authority that came from operating at the highest levels of an organization for long enough that it had settled into the voice itself. This is Deputy Inspector General Maureen Stahl. I'm calling because I've been briefed on the Reyes case, and I wanted to speak with you directly. Nora stopped walking. Deputy IG. Not field level. Not regional level. I've reviewed the preliminary findings, Stahl said, and I've reviewed a summary of your service record, The portions that were cleared for our access. A pause. I want to ask you something that isn't in any of the official paperwork. All right, Nora said. Your assignment to a supply rotation at a regional medical center with a redacted record and no disclosed specializations. Was that your choice, or was it a recommended placement? The corridor was empty in both directions. She thought about how to answer. Mine, she said. I chose the role. I chose this hospital. I wanted... She stopped and then said the accurate thing rather than the diplomatic one. I wanted to disappear into something small. I'd been operating at a level that had a cost, and I wasn't willing to keep paying it. I understand that, Stahl said. I'm asking because it matters for what I'm about to tell you. Nora waited. The DoD review of Sergeant Reyes' care is going to produce a formal commendation for your clinical decision-making, Stahl said. That commendation will be attached to your military record. It will also, given the circumstances, become part of the IG's public report on this incident. Public report. The two words landed with a specific weight. How public, Nora said. Regional Health Oversight, State Licensing Board, Hospital Administration, and a summary available to press inquiry under the public records provisions, Stahl said. Your name will be in it. Your training history, summarized, not classified details, will be in it. The full sequence of what happened at Cascade Ridge, including the institutional suppression, will be in it. Nora stood in the corridor and understood that the quiet, invisible life she had built in Dunmore, Wyoming was ending. Not because of anything she had done wrong, because of everything she had done right. Is there anything I can do to prevent that? She said. You could request a name redaction, Stahl said. Given your service history, there's a process for it. It would likely be granted. She thought about Petra Okafor, about the two other nurses whose names she didn't have, who had filed complaints and been erased from the record and had eventually left. She thought about Park, standing in the doorway with a printed incident report and an apology for not doing more sooner. She thought about the redacted file that had made it so easy for Darlene to manage her, and how the redaction had been protection and invisibility at the same time, and how those two things had turned out not to be the same. No, she said. Don't redact it. A brief pause. All right, Stahl said. The report will be finalized within 10 days. I wanted you to have the full picture before it was released. I appreciate that. One more thing, Stahl said. There's a question in the DoD review about the command structure that placed Sergeant Reyes' transport team without alerting civilian medical facilities in advance of their arrival. That's a procedural failure on our side, and it's being addressed. She paused. But it also means that if you had not been in that building, there would have been no one in the ER at Cascade Ridge capable of identifying his presentation correctly. Nora didn't answer. That's not a comfortable thing, Stahl said. I'm not saying it to make you feel better. I'm saying it because it's in the record, and you should know what the record says. The call ended. She stood in the empty corridor for a long moment. Then she walked to the stairwell, climbed one flight, and pushed through the door into the ER wing, not because she needed to be there, but because she needed to be somewhere with motion and noise, somewhere that asked something specific of the body instead of leaving everything to the mind. The ER was in its late afternoon rhythm, busy but not overwhelmed, the particular productive noise of a department managing its load. Two nurses she recognized from the overnight rotation were doing handoff documentation at the station. An orderly she'd seen dozens of times without ever learning his name was moving a wheelchair toward the far bay. Darren, the charge nurse who had told her in October that she wasn't a pharmacist, was reviewing charts at the far end of the station. He looked up when she came through the door. Their eyes met. He held her gaze for a moment, not confrontational, not warm, but with the look of a man doing an accurate accounting of something. And then he turned back to his charts. She was about to turn back to the stairwell when Torrance appeared from Bay 4. Nora. Her voice had the specific quality of someone carrying information they needed to deliver carefully. There's someone in Webb's office. Who? Hospital board chair, Torrance said. She drove in from Cheyenne. She's been up there for 40 minutes. Torrance paused. And she asked the front desk for your personnel file when she arrived. Nora processed this. How do you know? She said. Because the front desk clerk is Darren's cousin, Torrance said, and Darren told me 5 minutes ago. The board chair. driving in from the state capitol on a Wednesday afternoon because something in a preliminary IG report had required a same-day response. "What's her name?" Nora said. "Hartwell. Joyce Hartwell." Torrance watched her. "Do you know her?" "No," Nora said. But she understood what it meant that Joyce Hartwell was in this building. The IG report had not yet been finalized. The nursing board hearing was 3 weeks away. The institutional process was still running its measured, deliberate course, and the board chair had driven 4 hours on a Wednesday afternoon to read a supply nurse's personnel file. She turned back toward the stairwell. "Where are you going?" Torrance said. "To the supply room," Nora said. "I have a restock that's 3 days behind." She went down the stairs and along the corridor and through the supply room door, and she started pulling the afternoon delivery boxes and breaking them down and placing their contents on the appropriate shelves, and her hands moved with the automatic precision of 7 months of practice. And she thought about nothing in particular. She was halfway through the second box when she heard footsteps in the corridor. Deliberate, unhurried, the footsteps of someone who knew where they were going. They stopped at the supply room door. She turned. A woman in her late 60s, well-dressed in the understated way of someone with institutional authority who had stopped needing to demonstrate it. Sharp eyes, the kind that had been reading rooms for decades. Behind her was Webb, and behind Webb, barely visible in the corridor, was Drummond. "Ms. Vasquez," the woman said, "I'm Joyce Hartwell. I'm the chair of the hospital board." She looked around the supply room with an expression that contained several things at once: assessment, and something that might have been anger directed not at Nora, but at the room itself, at what the room represented. "I've been reading your file." "All right," Nora said. "I have a question," Hartwell said, "and I'd like a direct answer." "I'll do my best." Hartwell looked at her steadily. "In 7 months at this institution, how many clinical situations did you observe that required an intervention you were prevented from making?" The supply room was very quiet. Nora thought about how to count them. Not the small things, the routine corrections, the rerouted supply errors, the things she had managed through back channels. The significant ones. The ones where a patient's outcome had depended on a decision she had been shut out of making. 7, she said. "That I documented." Hartwell's jaw was set. "And the ones you didn't document?" she said. The question hung in the supply room with the weight of the only accurate answer, which was more than 7, and Nora had stopped counting somewhere around month 4 because counting them had made the days very long. "More," Nora said. Hartwell nodded once, the nod of someone confirming something they had already suspected. "I'd like you to come upstairs," Hartwell said. "I have some things I'd like to discuss with you, and I'd prefer to do it somewhere that isn't a supply closet." She turned and walked back down the corridor. Webb caught Nora's eye briefly as he turned to follow. His expression was not apologetic this time. It was something more complicated and harder to name. The look of a man watching a correction begin, knowing it was long overdue, and knowing also that corrections of this kind always cost more than they should have. She set down the box she was holding. She followed them to the elevator. The elevator doors closed, and as it rose, Nora looked at the floor indicator and thought about the last 7 months, and the supply cart, and Damon Reyes, and the 40 missing minutes, and the 5 deleted reports, and the particular shape of an institution that had been protecting itself so long it had forgotten what it was supposed to be protecting in the first place. The doors opened on the 4th floor. She stepped out. And in the 4th floor corridor, standing outside the boardroom with a phone in her hand and the unhurried posture of someone who had been expecting this moment, was Major Elena Valdez. Nora stopped. Valdez looked at her. "There's someone on the phone for you," Valdez said. "He insisted on talking to you before the board meeting." She held out the phone. Nora took it. "Vasquez." The voice on the line was rough-edged with medication and fatigue and something else. The quality of a man who had decided he was going to say something and was going to say it correctly. "It's Reyes." A pause. "I need you to know something before you go in there." "I'm listening," she said. "I've been trying to figure out how to say this since yesterday," he said, "so I'm just going to say it straight. 14 months ago, I filed a commendation request for you, for the extraction. It went through the chain, it got approved, and then somewhere in the processing it got flagged as sensitive and sat in a classification hold." Another pause. "They released it this morning. It's part of the record now." She held the phone. She thought about 14 months ago. A commendation request. filed and held and sitting in a classification hold while she had been counting bandages in Wyoming. "Why are you telling me this now?" she said. "Because you're about to walk into a room full of people who are looking at your file," he said, "and I wanted you to know that the file is complete, that everything that should be in it is in it." His voice was quieter now and less formal, closer to the way he had spoken in the field when the work was done and they were waiting for extraction. "You earned it, Nora, a long time ago, before any of this. It's yours." She stood in the fourth-floor corridor with the phone at her ear and said nothing for a moment. Then, "Get some sleep, Reyes." "Working on it," he said. She handed the phone back to Valdez. Valdez looked at her with the particular assessment of someone who had just watched something settle into place. "Ready?" Valdez said. Nora turned toward the boardroom door, and that was when her own phone buzzed in her pocket. The personal one, the one with fewer than 12 numbers in it, with a message from the unknown number that had been sending her 4- and 5-word dispatches for the last 2 days. This one was longer. "Darlene retained a lawyer an hour ago. Her position is that the record alterations were authorized by a verbal directive from a senior administrator. She's naming Webb." She read the message twice. Then she put the phone in her pocket and stood in the fourth-floor corridor and thought about it with the same flat analytical stillness she had been using all week, because panic was still useless, and the situation had not actually changed. Only her understanding of it had. Darlene was naming Webb, a verbal directive from a senior administrator. That was the claim. No documentation, no paper trail, nothing that could be independently verified, because verbal directives left no access logs, no timestamps, nothing that could be pulled and printed and laid on a table in front of an IG investigator. It was the only move available to a person whose name was on 9 separate record alterations in a system that logged every keystroke. She looked at Valdez. "Did you know about this?" Nora said. "About Marcia's attorney?" Valdez shook her head. "Not until 30 seconds ago. I can see your screen from here. Webb is about to walk into a board meeting without knowing his name is on a counter-allegation." Valdez was already pulling out her own phone. "I'll get Drummond." "Do it fast," Nora said. She pushed the boardroom door open. The room was not large. A rectangular table, 8 chairs, a credenza along one wall with a water pitcher, and glasses nobody had touched. Hartwell was at the head of the table. Webb was to her right. 2 other people Nora didn't know, board members by the look of them, arrived quietly while Nora had been in the supply room, were on the left side. Everyone looked up when she came in. "Ms. Vasquez," Hartwell said, "please sit." Nora sat. She looked at Webb directly. "There's something you need to know before this starts." Webb looked at her with the careful attention of someone who had learned in the last 48 hours to treat unexpected information from this particular person as significant. "Darlene Marsh retained legal representation approximately an hour ago," Nora said. "Her stated position is that the record alterations were authorized by a verbal directive from a senior administrator at this facility." She held his gaze. "She's naming you." The room was very quiet. Webb's expression went through something. Not guilt. She didn't think it was guilt, but the specific shock of a person confronting an accusation so disconnected from their actual conduct that the first response was pure incomprehension. "That's—" He stopped. "False?" Hartwell said. "Completely." His voice was even, but his jaw was tight. "I have never authorized any modification to incident reporting records. I have never issued a verbal or written directive to that effect. I was not aware the modifications were occurring." Hartwell looked at him for a long moment with the particular assessment of a woman who had been evaluating people's honesty in high-stakes environments for most of her professional life. "All right," Hartwell said. "You believe me," Webb said. "Not quite a question. I believe the access logs show Marcia's credentials on 9 modifications and yours on none," Hartwell said. "I believe the IG investigator has been in this building for 2 days and hasn't put your name in any of his preliminary documentation. And I believe that people who are genuinely guilty generally don't look as confused as you do right now." She picked up the water pitcher and poured herself a glass, with the deliberate calm of someone who is going to handle this at her own pace. "I also believe her attorney knows all of that, which means this tactic is not about winning. It's about delay and disruption." Webb was quiet for a moment. Then, "She's trying to muddy the investigation." She's trying to make the investigation expensive enough and complicated enough that the institution considers settlement over accountability, Hartwell said. It's a reasonable strategy from her position. She set the pitcher down. It's not going to work. The door opened. Drummond came in with the particular unhurried efficiency of someone who had been doing this long enough to know that urgency and speed were not the same thing. Ferris was behind him. Behind Ferris was Valdez, who positioned herself against the wall in the way that operators positioned themselves. Peripheral, observant, ready. I've been briefed on the Marsh counter-allegation, Drummond said. He placed a thin folder on the table. I want to address it directly because it affects the timeline of the formal report. He opened the folder. Darlene Marsh's attorney contacted our office 22 minutes ago, he said. The allegation, as stated, is that Dr. Garrison Webb issued a verbal directive in March of last year authorizing the removal of complaint reports that negatively impacted departmental metrics. That's the specific language. He looked up. In the last 20 minutes, I've reviewed Dr. Webb's facility access logs, his administrative correspondence records, and the department head meeting minutes for March of last year. Nobody moved. Dr. Webb was at a regional health system conference in Denver from March 9th through March 14th, Drummond said. The meeting minutes for the March department heads meeting, which Marsh chaired in his absence, show no record of a directive discussion. His correspondence records for that month contain 0 communications with the ER department regarding incident report management. He closed the folder. The allegation has no corroborating evidence and is directly contradicted by 3 separate administrative records. Hartwell looked at Webb. Webb looked at the table. Something in his shoulders released, not dramatically, just the very slight adjustment of a person who had been holding themselves rigid against an impact and had just been told it wasn't coming. How long before that's formally documented? Hartwell said. It will be in the IG report as a formally investigated and rejected counter-allegation, Drummond said. That's actually more useful to Dr. Webb than if the claim had never been made. It creates a clear, documented record of the allegation and the evidence that refuted it. Nora watched Webb process this. The thing about being the person who documented everything, she thought, was that documentation worked in both directions. You built it as a defense, and sometimes it became a vindication. The board meeting lasted another 90 minutes. It was not smooth or simple or the kind of institutional proceeding where things resolved cleanly and everyone left satisfied. There were disagreements about process. One of the 2 board members she didn't know, a man named Croft, kept raising questions about the liability exposure of the IG report being made public before the hospital's own legal review was complete. And those questions were not unreasonable, and Hartwell addressed them with the patience of someone who had considered them already and had still arrived at the same position. The hospital's liability exposure was real. The public report would create scrutiny. There would be regulatory reviews, potential civil claims from nursing staff whose complaints had been deleted, questions from the state health department that would not be quick or comfortable to answer. All of that was true. And all of that, Hartwell said, in the measured tone of someone stating the obvious to people who needed to hear it stated, was the consequence of what had been allowed to happen. The question was not how to avoid the exposure. The question was how to respond to it in a way that demonstrated the institution was capable of accountability. Croft sat back in his chair. What does that look like in practice? He said. It starts with this conversation, Hartwell said. She looked at Nora. And with a formal acknowledgement of what Ms. Vasquez experienced at this institution and what it cost. The room was quiet. Nora had spent 7 months not wanting to be looked at in this building. She sat in the boardroom and let herself be looked at. I'm going to be direct, Hartwell said, and she was addressing Nora now, the others in the room peripheral to this specific exchange. The scope violation complaint against you is being formally withdrawn by this institution. The withdrawal will be communicated to the nursing board in writing today, signed by me, with a summary of the institutional misconduct that contextualized the complaint's filing. She paused. Your personnel file will be corrected. The documentation that was used to build a case for your non-renewal will be reviewed, and anything that cannot be substantiated by accurate records will be removed. Nora said nothing. Additionally, Hartwell said, your employment at this facility is not ending in 29 days. If you want to stay, and I recognize that's not a simple question given what happened here, there is a position in this hospital that reflects your actual qualifications. What position? Nora said. Trauma department. Full clinical scope. We'll need to formalize the credentialing given the classification issues around your training record, but Drummond has indicated the DoD is prepared to provide a summary certification that will satisfy the licensing requirements. Hartwell held her gaze. You would not be restocking supply shelves. Nora thought about the supply room, the chair behind the door, the IV bag count. The particular discipline of doing a small job carefully and completely and without complaint. She had not hated it. That was the honest truth. She had found, in the 7 months of doing it, a kind of stripped-down clarity that she hadn't known she needed. The work had been legible. The outcomes had been immediate. Nobody died if she miscounted bandages. But she had also stood in a trauma bay at 6 a.m. and known, with the complete certainty of her entire trained self, exactly what was happening to the man on the gurney and exactly what needed to be done about it. And she had not been wrong. "I'll stay," she said. Hartwell nodded. It was not a celebration. It was an acknowledgement. Two people across a table who understood that something had been broken and was beginning, slowly and imperfectly, to be addressed. The meeting ended. She walked out of the boardroom at 6:12 p.m. and stood in the fourth-floor corridor in the quiet of a hospital evening and breathed. Valdez was still there. She had waited. "How'd it go?" Valdez said. "The way things go when institutions are trying to fix something they should have prevented," Nora said, slowly, with a lot of people in the room. But moving, Nora said. Valdez studied her. "Are you going to stay?" "Yes." Something in Valdez's expression shifted. Not surprise, but a particular kind of recognition, like she had predicted this and was confirming it. "Good," she said. "For what it's worth. I think it's the right call." She paused. "I also think it's a harder call than going back would have been, and I think you know that." "I know that," Nora said. "The visibility," Valdez said. "The report. Your name in it." "I know. People are going to look at you differently." "They already do," Nora said. "They have been since Tuesday morning." Valdez was quiet for a moment. Then, "He's being discharged in 2 days. Reyes. The surgical team cleared him this afternoon. I'll go see him before he leaves. He'll want that." Valdez picked up her bag from the floor beside the wall. "Nora, the commendation. When it's processed and in your record, that's going to open doors. I want you to know that. If you ever—" "I know," Nora said. "I know where to find you." Valdez left. Nora stood in the corridor alone for a while. Then she took the stairs down to the ground floor and walked out through the main entrance into the Wyoming evening, which was cold and clear and smelled like cut grass from somewhere nearby, and the particular dry mineral smell of high-altitude air, and she stood on the sidewalk outside the hospital she had come to in order to disappear and thought about what it meant that she had failed at that. She thought about the version of herself that had packed a single bag and driven to Dunmore with a plan to be no one for a while. She didn't think that version had been wrong, exactly. She had needed the supply room. She had needed the quieter rhythms of a smaller life, the discipline of doing simple things well, the long months of not being Viper and finding out what remained when you took that away. She had needed to find out whether she could exist without the urgency, whether there was a person inside the operator who could sit in a chair behind a door and count IV bags and not disappear entirely. There was. She was still here. But the supply room had also been a kind of hiding, and hiding had turned out to have a shelf life. You could maintain it for a while, even build something real inside it, but eventually the thing you were hiding from came through the door, or came through the ambulance bay, or called you on a line you hadn't given to many people. And the question was no longer whether you were going to be seen, but how you were going to handle being seen when it happened. She had handled it, not perfectly. Her hands had not been steady every moment. She had made the fast gel go on wrong in the first seconds because the cart was positioned for a right-handed operator, and she had overcorrected in the field and undercorrected in a civilian setting, and that kind of small failure was the texture of actual competence rather than performed competence. You were good enough to catch your mistakes before they became consequences. She drove home. She made tea instead of coffee for once, and sat at the kitchen table with it and called her sister. "Well?" her sister said. "I'm staying," Nora said. A pause. "At the hospital." "Yes?" "The one that tried to fire you." "The one that tried to fire me," Nora said. "It's complicated." "Most things are," her sister said. "Are you okay?" Nora thought about the honest answer. I think I'm getting there, she said. That was true enough. The next 2 days moved differently than the previous ones. Not faster, not slower, but with the particular quality of time that has found its own direction, where events had weight and sequence and consequence, rather than the pressurized suspension of a situation that hasn't broken yet. The IG's preliminary report was formally shared with hospital administration on Thursday morning. Drummond briefed Webb and Hartwell together, and Nora was not in the room for it, which was appropriate. She was in the second-floor break room with a coffee and the particular ability to not be in rooms she didn't need to be in, which was something the supply rotation had given her. The state health department contacted the hospital Thursday afternoon and requested a meeting the following week. That request had been anticipated, and Webb had already prepared the documentation response, and the hospital's legal team, which had been quietly expanded by 2 members since Tuesday, was involved in every step of the process. Darlene Marsh's attorney filed no further counter-allegations. The naming of Webb had been a single move, deployed fast and refuted faster, and without that leverage, the legal strategy appeared to have shifted toward negotiation rather than confrontation. Drummond mentioned this to Nora on Thursday in passing, with the neutral observation that it suggested Marsh's attorney had reviewed the access logs and arrived at the same conclusion everyone else had. Preston Hale's administrative leave was extended pending a formal review of his clinical documentation over the 14-month period. This was a separate process from the IG investigation. An internal peer review, conducted by physicians from outside the facility, which Hartwell had commissioned on Wednesday evening. Nora did not know what it would find, and she did not need to. She had documented what she had documented. Other people would do what other people would do. That was how accountability worked when it worked. Not in one dramatic moment, but in the slow, unglamorous accumulation of documented truth, reviewed by enough people in enough different institutional roles that the weight of it became impossible to redistribute. On Friday morning, she went to see Reyes before his discharge. He was dressed and seated in the chair beside the bed. Not yet fully himself, the pain management still visible in the careful way he was holding his core, but present in the particular focused way that was just how he was when he was awake and functional. "You look like you're going to make it," she said. "I looked like that yesterday too," he said. "You just weren't here to see it." She sat. "Valdez told me about the board meeting," he said. "I figured." "Trauma department." He held her gaze. "That's right." "It feels right," she said, which is different from feeling easy. He nodded. "Yeah." He was quiet for a moment, turning something over. "You know what I've been thinking about since Tuesday?" "Tell me." "The field, the extraction." He said it carefully, with the specific economy of someone referencing something they had agreed was not to be described in detail. There were 3 of us in that position who knew what to do, and only one of us who was in the right place to do it. And I kept thinking afterward, what if you hadn't been there? Not because you were supposed to be there, not because anyone planned it that way, but just because of how it fell. He looked at the window. "The thing about people like you, Nora, people with what you have, is that you can try to keep it in a box. And sometimes you get to. But eventually the world presents you with a moment where the box is the wrong choice, and the box costs more than having opened it would have." She thought about the Tuesday morning she had driven to the hospital at 5:58 a.m. with her badge and her keys, and the knowledge that she was making a choice that couldn't be unmade. "I know," she said. "I just wanted to say it out loud," he said. "Once. To your face." He looked back at her. "You saved my life. In that trauma bay, and not for the first time. I want that to be on the record between us, even if it never goes anywhere else." She held his gaze for a moment. "It's on the record," she said. He was discharged at 11 a.m. Valdez took him out through the main entrance in a wheelchair. Hospital policy, which he objected to with the specific objection of a man who walked under his own power as a matter of professional identity. And Nora stood near the entrance desk and watched them go, and she did not feel the particular ache of departure that she had sometimes felt in other contexts, other goodbyes. She felt instead something more solid, a thing completed, a thing handled. She went back upstairs. The credentialing process for her transfer to the trauma department was, as Hartwell had predicted, not fast. There were forms and verifications, and the particular bureaucratic complexity of translating a partially classified military training record into a civilian hospital's credentialing framework which required coordination between the DoD Compliance Office and the State Nursing Board and the hospital's own medical staff office, and it would take weeks. But it was moving. In the interim, Webb had authorized an expanded role for her in the ER. Not a formal trauma designation, but a practical acknowledgement that she was permitted to provide clinical input in acute situations, documented through a temporary scope extension that the hospital's legal team had constructed with careful attention to the nursing board's contested complaint. It was not clean. It was not the elegant solution of a situation where everything had resolved at once into its proper shape. It was the actual solution, which was partial and imperfect and workable, which was the only kind of solution that real situations produced. She worked within it. She was in the ER on the following Tuesday, exactly 1 week after Reyes had come through the ambulance doors, when a patient came in by ambulance from a construction accident 40 miles out. Crush injury, right leg, with a pressure reading that put him in the gray zone between manageable and critical. The attending was a doctor she hadn't worked with before, a woman named Solis, brought in as a temporary attending to cover the gap left by Preston's administrative leave. Solis was competent, direct, and had the particular professional confidence of someone who had read a situation correctly on most of the occasions it mattered. Nora was restocking the adjacent bay when Solis came out of the trauma room. Vasquez. Direct. No preamble. I have a crush injury patient with compartment syndrome developing. I want a second opinion on the pressure measurement before I commit to fasciotomy. You available? Yes, Nora said. She went in. She examined the patient, mid-40s, alert but frightened, with the particular pallor of someone whose body was announcing that something was very wrong, and confirmed the compartment pressure reading and agreed with Solis's assessment in approximately 90 seconds. Fasciotomy is right, she said, sooner rather than later. That's what I thought, Solis said. Thank you. She moved and Nora stepped back, and that was it. Clean, collaborative, properly ordered, the way it was supposed to work when the people in a clinical environment were operating from their actual capabilities rather than their assigned positions on an org chart. Torrance caught her eye from across the corridor. Nora looked back at her. Torrance didn't say anything. She just gave a single, brief nod that contained everything the moment required and turned back to her own work. The nursing board hearing was held 3 weeks later in the state capitol. Nora drove to Cheyenne on a Tuesday morning in a car that had needed an oil change for 6 weeks and that she had finally taken in the previous weekend, and she sat in a formal hearing room for 4 hours with Suki Perot beside her and the accumulated documentation of 7 months of institutional misconduct laid out in the formal language of a licensing board process. It was not dramatic. These things were never dramatic. They were long and procedural and precise, and the outcome, when the board returned it 2 hours after the session ended, was 5 words in an email that Suki read aloud to her in the parking lot. Complaint dismissed. Record remains clean. Nora stood beside her car in a Cheyenne parking lot in November, cold and read those 5 words twice. Her record remained clean. It had always been clean. The record, she thought, had never been the problem. The problem had been who got to decide what the record meant, and who got to remove the parts they didn't like, and who got to put a woman with a 3-year gap and a redacted file on a supply rotation and assume she would stay there until it was convenient for her to leave. She drove back to Dunmore. The formal IG report was released 11 days after the hearing. Regional distribution, as Stahl had said, state health oversight, licensing boards, hospital administration, public records. Her name was in it, in the clinical summary section, with a 3-paragraph description of her training background and her role in Sergeant Reyes's care and the institutional context that had surrounded both. She read her own name in a document she had not written and felt the particular disorientation of that, the way your life looks when it's been organized by someone else's language, accurate and strange at the same time. But it was accurate. That was the thing. It was accurate, and it was documented, and it was not going to be removed. Darlene Marsh faced a formal review by the State Health Department that concluded 4 months after the IG report in the revocation of her health administration certification. She would not supervise a clinical department again. Her attorney had negotiated that outcome instead of the worse one, which spoke to the quality of the case against her and the pragmatism of everyone involved. Preston Hale's peer review concluded with a formal finding of documentation irregularities and a required remediation program, a structured supervision period, retesting of clinical protocols, Documentation of 18 months of supervised practice before he could return to unsupervised attending status. His career was not ended. It was restricted and watched and made accountable in the way it should have been accountable for longer than anyone wanted to quantify. The three nurses whose complaints had been deleted before Nora's arrival were contacted by the hospital's legal team and offered formal acknowledgments and restitution. One of them, Petra Okafor, whose complaint about unsafe patient handoff procedures had been the first to disappear, was offered her position back. She declined. Nora understood why. Some things could be acknowledged without being undone. The acknowledgement mattered. The undoing was a different kind of impossible. Her trauma department credentialing was finalized on a Thursday in late January, 4 months after Reyes had come through the ambulance bay doors. Webb gave her the paperwork in his office, and he shook her hand, and the handshake was slightly awkward, in the way that handshakes were slightly awkward between people who had been through a difficult and consequential thing together and were not yet sure what kind of relationship they were building on the other side of it. "There's something I want you to know," Webb said. She waited. "The 2 audits," he said, "the ones Ferris mentioned, where the anomalous metrics had been flagged. I've gone back through my records. I found the briefings." He looked at his desk rather than at her. "I was told the department was managing a period of staff transition and that the metrics would normalize. I accepted that." He looked up. "I should have asked what managing meant." She held his gaze. "Yes," she said. "You should have." He accepted it. That was the version of accountability that didn't come with consequences. The kind where you had not acted with malice but had not acted at all. Where the institutional machinery had run its damaging course, partly because the people who could have interrupted it had found it easier not to look closely. That version didn't end careers. But it lived in people, or it should. It should make you look more closely the next time. She left his office and walked down to the trauma wing. She had a shift starting in 20 minutes. She changed in the locker room she now used, not the supply staff locker room, a different one with different faces and different conversations. And she stood in front of the mirror for a moment in her scrubs and her badge and the particular plainness of herself at the start of a working day. She was 34 years old. She had a 3-year gap in her employment record that was no longer the whole story. She had spent 7 months counting IV bags in a room by herself, and she had learned something in that room that she hadn't expected to learn, that the quiet was not a lesser version of the work, but a different relationship to it, and that she had needed the relationship before she could come back to the work without the work being the only thing. She had also learned that she was not, in fact, the kind of person who could keep her hands to herself when something needed doing. That had turned out to be structural rather than incidental. Some people were built for the long game of patience and restraint, and she could sustain it for a while. But eventually, there was a man losing blood on a gurney, and the patience stopped being a choice. She was not sorry about that. She had been sorry about a great many things in her life. Choices made under pressure, people not reached in time, the particular cost of operating at the level she had operated at for the years she had operated at it. She had a collection of those sorrows that she carried without dramatizing, the way anyone carried the weight of work that had mattered and cost something real. But she was not sorry about Tuesday at 6 a.m. She would not be in any version of this story she could construct. She walked out of the locker room and down the corridor to the trauma department, and the department was mid-morning busy, and Solis was at the board reviewing cases, and Park was doing documentation at the station, and Torrance was in Bay 2 with a patient who had come in from a car accident on the highway and needed a hand, and Nora went to help her. She did not think, as she walked in, about what she had been 7 months ago, or what she was now, or the distance between those two things. She thought about the patient in Bay 2. That was the job. That had always been the job. The rest of it, the visibility, the report, the formal credentialing, the board hearing, all of it, was the institutional world doing what institutional worlds did when they were functioning as they should, which was to say slowly and with friction and at a cost that was never equally distributed and always higher than it should have been for the person who had simply been right all along. She had paid that cost. She was not paying it anymore. That evening, after her shift, she sat in her car in the hospital parking lot for a few minutes before driving home. Not because she was upset or overwhelmed, but because she had developed the habit, over the last several months, of taking that specific transition seriously. The moment between the hospital and everything else. The boundary between the person who did this work and the person who existed apart from it. She had learned that the boundary needed tending. That was one of the things the supply room had taught her, actually. The discipline of smallness, the practice of ending a day cleanly and going home to something that was not the work. She intended to keep that, even now that the work had expanded back into what it had once been, especially now. She started the car. She drove past the parking lot exit and past the ambulance bay and past the main entrance. And as she turned onto the main road, she caught, for a second, the lit shape of the hospital against the evening sky. Blocky and institutional and ordinary. The kind of building that looked like nothing from the outside and contained, behind its ordinary walls, the particular compressed intensity of human emergency happening on every floor at every hour. She had chosen this building. She had chosen it specifically for its ordinariness, its out-of-the-way quality, its distance from the life she had been trying to step away from. She had walked in with a single bag and a plan to be invisible. She had failed at that completely. And in failing at it, she had become visible in the only way that actually mattered, not to the people who needed to manage her, not on the terms of an institution that had tried to make her smaller, but to the person in the gurney with 40 minutes left and no one else in the building who knew what to do. That was the thing about the kind of quiet you built around yourself when you had been through something large. You could make it real, and you could maintain it, and you could find genuine value in it. The rest, the simplicity, the uncomplicated dailiness of a smaller life. But you carried what you carried, and the world occasionally needed what you carried. The question was not whether you were going to be asked. The question was whether you were going to answer when you were. She had answered. She would answer again. She drove home through the cold Wyoming dark, and she was not Viper, and she was not just a supply nurse, and she was not the decorated medic from the classified files, and she was not the woman who had spent 7 months disappearing. She was all of those and none of them entirely. She was Nora Vasquez, and she was 34 years old, and she had a shift at 7 a.m. and a credentialed position in a trauma department, and a record that said exactly what it should say. And the life she was going home to was small and real and entirely her own. Some people spent their whole lives waiting for someone to see them clearly. Some people stopped waiting and went back to work. The choice, when it came, was rarely clean and never comfortable. And the people who thought it would be had usually not yet been in the room when it mattered. She had been in the room. She knew what it cost and she knew what it was worth. And she was still, at the end of all of it, choosing to be there. That was not a small thing. It was in fact the only thing.